All right, folks, let's talk about Nigeria, land of vibrant cultures, beautiful, hard-working people, delicious jollof rice, and sadly, rampant corruption, abuse of power and privileges. But this isn't about politicians literally stuffing their pockets with cash, though there's plenty of that too. This is about how corruption is eating away at Nigeria's healthcare system, leaving everyday Nigerians struggling to get the care they desperately need. We're talking about money for hospitals ending up in private bank accounts. Money is budgeted for critical health infrastructures that develop winds to the Cayman Islands or end up in septic tanks buried in underground crypts. We're talking about essential medicines and equipment vanishing into thin air and politicians storing edible items meant for distribution to the public in warehouses until they expire. Healthcare managers hoard equipment meant for training only to be brought out during inspections or audits. It's a story of betrayal, where those entrusted to protect the people's health choose greed instead. And the consequences, they're ever so devastating. But this isn't just a Nigerian problem, folks. Corruption is a global disease, and it's time we found the cure, one country at a time. There is a proverb from the Yoruba people in Nigeria. It is not only the man who stole items from the attic who should be called out as a thief, the man who helped him to place it on the ground, the man who helped him to sell it, and even the buyers should be called out as one. So buckle up, because we're about to explore the murky world of corruption in Nigeria's healthcare system, from politicians to healthcare managers to HMO managers, regulatory agencies and service users alike. Get ready to be informed, outraged and hopefully inspired to act. Now, before we go any further, let's talk economics for a second, specifically something called opportunity cost. Don't worry, it's not as boring as it sounds. Basically, every time you make a choice, you're also choosing not to do a bunch of other things. Think of it like this. You've got 10 naira. You can use it to buy a delicious plate of jollof rice. You can also use it to buy salad. Well, let's be honest, you're getting the jollof, but the point is you can't have both. That's an opportunity cost in a nutshell.
So, how does this apply to Nigeria's healthcare system? Well, every naira stolen through corruption is a naira that could have been spent on life-saving equipment, training skilled doctors and nurses, expanding infrastructures, or providing affordable medicine. That's the real cost of corruption, the lost potential, the missed opportunities for a healthier Nigeria.
Let's talk numbers, shall we? Nigeria loses billions of dollars every year to corruption. That's billions with a B, folks. Money that could be building new hospitals, equipping clinics, and training healthcare workers is instead lining the pockets of corrupt officials. Think about it, a single MRI machine can cost upwards of $1 million. That's a lot of money, right? Now imagine how many machines could be purchased with the billions lost to corruption. It's enough to make your head spin. But it's not just about big ticket items. Corruption also affects everyday expenses like medicine and supplies. That community pharmacy arbitrarily inflates essential medicines prices because there is no effective pricing system and no oversight functions from regulatory authorities. Prices skyrocket when contracts are awarded based on bribes instead of merit, and quality plummets. Healthcare infrastructures that should be maintained and turned around yearly are not done, so they break down faster and people pay more to buy replacements if they are ever bought. The result? Nigerians are forced to pay exorbitant prices for substandard care. It's a lose-lose situation. Now, let's talk about the people on the front lines of healthcare, the doctors, nurses, and other medical professionals. Corruption doesn't just drain resources, it also drives away talent.
Imagine you're a brilliant young doctor, fresh out of medical school. You're passionate about helping people, about making a difference. But then you see the state of the healthcare system, understaffed, underfunded, and riddled with corruption. Would you stay? Or would you pack your bags and seek opportunities elsewhere?
That's the reality in Nigeria. Brain drain is a serious problem as skilled medical professionals flee the country in search of better pay and working conditions. And who can blame them? When corruption is rampant, it's not just their careers that are at stake, but their very integrity and even lives, as they are not sure they will survive, should they need to use the healthcare system in an emergency. Section 5, crumbling clinics, missing meds, access and quality issues. So we've talked about the financial cost of corruption and we've talked about its impact on human resources. Now let's talk about the most important stakeholders, the patients. Because of corruption, millions of Nigerians lack access to primary healthcare. Hospitals are overcrowded, understaffed, and ill-equipped. There is a cumbersome bureaucratic hierarchy, and feuding professionals are always on industrial strike. The sad story goes on and on. But who cares? Definitely not the politicians and healthcare managers, as they can afford air ambulances to take them out of the country in an emergency, all the cost of which is borne by the commoner. Essential medicines are often unavailable or prohibitively expensive. In rural areas, the situation is even more dire, with many communities lacking even the most basic healthcare facilities.
This lack of access and quality has real consequences. People die from preventable diseases. Expectant mothers lack access to proper prenatal care. Children suffer from malnutrition and preventable illnesses. It's a heartbreaking reality, and it's a direct result of corruption.
A sick society long-term socioeconomic impacts. However, the consequences of corruption in healthcare extend far beyond the walls of hospitals and clinics. It's like a poison that seeps into every corner of society, undermining development and progress. Think about it. A healthy population is a productive population. When people are sick, they cannot work, they cannot contribute to the economy, and they cannot reach their full potential, physically and mentally.
Children who are malnourished or suffer from preventable diseases are less likely to succeed in school and contribute to society later in life. Corruption in healthcare creates a vicious cycle. It leads to poor health outcomes, which in turn leads to lower productivity, reduced economic growth, and increased social instability. It's a recipe for disaster, and it's time for Nigeria to break the cycle.
Section 7, Kogi State, a case study in corruption's casualty. Let's get specific, shall we? Kogi State, located in central Nigeria, provides a stark example of how corruption can cripple a healthcare system and devastate a population. In 2023, reports emerged that millions of dollars meant for healthcare in Kogi State had been diverted to private accounts. About $48 million, the Economic and Financial Crime Commission alleged that the immediate former governor of the state had pocketed the amount during his tenure. This money, if used properly, could have been transformative. It could have built new hospitals, equipped clinics with life-saving equipment, and provided essential medicines to those in need.
Let's put this into perspective. With just a fraction of the misappropriated funds, Kogi State could have purchased hundreds of incubators for newborns, thousands of mosquito nets to prevent malaria, or trained hundreds of healthcare workers. This fund could have bought 48 MRI scanners, 32 CT scanners, 322 modern X-ray machines, 966 ultrasound machines, 2,415 dialysis machines, 1,932 ventilators, and 4,831 ICU beds. This fund is more than half of what was used to construct the Nightingale's Hospital in London, a 4,000-bed temporary hospital built during the COVID-19 pandemic. The hospital cost about $73 million. Instead, this money vanished into thin air, leaving behind a trail of broken promises and shattered lives.
Section 8, Fighting Back, the need for transparency and reform. So where do we go from here? How can Nigeria combat this pervasive corruption and rebuild its ailing healthcare system? Well, folks, it starts with transparency and accountability. Sunlight, as they say, is the best disinfectant. Shining a light on corrupt practices is essential to holding those in power accountable. Healthcare service users who are protecting the activities of corrupt leaders and individuals are doing a great disservice to themselves. This means strengthening anti-corruption agencies, empowering whistleblowers, putting regulatory agencies on their toes, and ensuring that public funds are used for their intended purpose.
But transparency alone is not enough. Nigeria also needs comprehensive reforms to its healthcare system. This includes decentralizing power, strengthening procurement processes, and investing in technology to improve efficiency and reduce opportunities for corruption.
Public accountability. The people demand answers. But real change won't happen overnight, and it won't happen from the top down. It requires a groundswell of public outrage and a demand for accountability. The people of Nigeria must hold their leaders responsible for the state of their healthcare system. This means demanding transparency in government spending, scrutinizing public contracts, and speaking out against corruption in all its forms.
It means supporting organizations working to improve governance and promote accountability, and calling on the health committees in both houses of the National Assembly to perform their oversight functions uprightly. It means being vigilant and refusing to accept corruption as business as usual.
The power lies with the people. By raising their voices and demanding better, Nigerians can create a brighter, healthier future for themselves and generations to come. It's time for the people to take back their healthcare system from the clutches of corruption. Section 10, Towards a Healthier Nigeria, a call to action. This isn't just about Nigeria, folks. Corruption is a global issue, and it demands an international response. The West and First World countries that are always quick to corrupt-wash Nigerians while also receiving stolen funds from corrupt Nigerian politicians need to know their two-faced actions have direct consequences on human lives in Nigeria. Natural resources-driven international agencies fueling insurgencies in Nigeria, thereby causing instability, hunger and devastation, need to be stopped. We need to support organizations working to promote transparency, accountability and good governance around the world. We need to demand that our leaders prioritize healthcare and ensure that public funds are used for their intended purpose.
We need to support healthcare workers and empower them to deliver quality care without fear of reprisal. This is a call to action, folks. Let's work together to create a world where everyone, regardless of where they live, has access to quality, affordable healthcare. It's a fight worth fighting, and together we can make a difference.
Section 11 conclusion, hope in the face of adversity. Look, I'm not going to lie. The situation in Nigeria's healthcare system can feel overwhelming. The scale of corruption, the lack of resources, the human cost, it's heavy stuff. But here's the thing about Nigerians, they're resilient. They've faced challenges before and they've always found a way to overcome them. And I truly believe that with enough pressure from the public, with real commitment from those in power, things can change. This isn't just about fixing a broken system, it's about saving lives. It's about giving every Nigerian a fair shot at a healthy life, and that's a fight worth fighting. So, let's get to work. Please share, like, and subscribe to this channel.